Neuromodulation is an advanced technique that can help people who have failed back syndrome, diabetic neuropathy, complex regional pain syndrome, just to name a few. These are cases where there's not a mechanical compression on your spine requiring surgical intervention, because in that case, this treatment would be inappropriate. But in cases where the nerves are damaged and the patient continues to feel pain down the legs or in the back, dorsal column stimulation can be extremely effective. Dorsal column stimulation operates on something called the gate theory of pain. Basically, the way to think about it is that the dorsal columns, or this very specific portion of your spinal cord located on the backside of the spinal cord, is responsible for pain. And by placing a low voltage electrical charge at the end of a wire in the epidural space in contact with that area, you simply overwhelm that area's sensory ability, and so that you just don't perceive the pain. It can sometimes result in a low-level buzzing, but this low-level buzzing that you feel in the legs is generally much, much more acceptable than the pain itself. The treatment is first done with a trial where we bring you into the office as an outpatient, and just through a needle, we place a wire in your epidural space, and while you're laying on the table, we actually communicate with you to see if the dorsal column stimulator trial is controlling both your back and leg pain. You then carry this around with wires hanging out of your back temporarily for a few days to be sure that you're very happy with the relief that you're getting. If you're not happy, we simply pull the wires out and the test or the trial is over. But in the cases where the patient is extremely happy because they had such severe pain, we then bring you back at a later date as an outpatient, typically in a surgery center or in a hospital, and we plant these same leads in your back, except this time the wires go under your skin and are attached to a battery that allows this to provide continuous pain relief. Think of it as a pacemaker for back pain. Dorsal column stimulation can be a miracle for those who have lived with severe pain for many, many years. If you've had previous surgery or you have chronic low back pain, that is pain that has lasted for more than a year, contact our office as you may be a candidate for dorsal column stimulation.